Are you a diabetic and on medications? Are you observing fast during Rosa or observing an Ekadashi fast? Well, fasting with diabetes has its own complication. One wrong medicine at the wrong time and wrong doses, your blood sugar can crash significantly. While if you follow a proper plan with proper dosing of the medication, you can have a uncomplicated fasting, be it Rosa, be it Ekadashi. Today we'll discuss about how to do a proper fasting with diabetes. As I had been doctor over the last 25 years, I have seen thousands of patients who are diabetic, but at the same time, they are fasting. And if you follow the advices properly, then even though you're diabetic, even though you're on medication, even though you're on insulin, if you want to observe a religious fast, you could observe it safely. So today we'll answer a few questions. Number one, what changes when you fast? What changes does it happen in our body when you fast? Second question, why to adjust medication? Why it is important that you adjust the medication, diabetic medication? Number three question, who requires the adjustment? Number four, how to adjust the medication? And number five, where do people usually go wrong? So we'll answer all those one by one. Stay with us till the end. So what happens to our body when we fast, especially prolonged fast during Ramadan or prolonged fast during Ekadashi as seen during Hindu rituals? So in Ramadan, there is a month-long fast and there is a period of long fast. So during that time, there is no food and there is no water also. Followed by there is heavy meal during iftari. So often the meal is heavy, and in the morning also, before the fast, usually it is very early morning meal and sometimes it is heavy too. So what happens when you do not adjust your medication, early morning medication, your blood sugar can come down significantly low during afternoon or late evening when there is no food and the diabetic medication is acting very strong in your body. At the same time, after iftar, if it is heavy and if it is a grain, it is a carbohydrate heavy and sweet heavy iftar, and if the medicines are not adjusted or dosed properly, your blood sugar could raise significantly after the iftari meal. So that's why it is important to adjust the dose of the medication. Otherwise, you can have dangerously high blood sugar, or at the same time, you can have dangerously low blood sugar. And sometimes there could be other life-threatening complications also of diabetes, like diabetic ketoacidosis, which is a significant medical emergency. So that's why it is important to adjust the doses of the medication, because if you do not adjust the dose of the medication, suppose you are not reducing the dose of medication and you are not taking proper food during our fasting stage, our blood sugar can fall significantly and we may have symptoms of hypoglycemia. We might have tremors in our hand, we might have palpitation, we might have excessive sweating, we can have confusion or dizziness, and if the blood sugar comes even lower, we might as well lose consciousness. So this happens when you do not adjust the dose or we do not bring down the dose. At the same time, sometime what happens, we bring down our dose significantly low, thinking that our blood sugar will come down if we do not bring our doses of the medicines. That also could be dangerous. If you bring our doses of the medicine too low, our blood sugar could raise also significantly high, and it could lead on to dehydration, and once again we could land up in a hospital emergency setting. So both low blood sugar as well as high blood sugar could be very, very dangerous in case of diabetics, and thereby proper adjustment of the diabetes medicines, either reducing or increasing, it is a bit complicated issue which needs to be tackled adequately with the proper consultation of a doctor. So adjustment of medication of diabetes is not optional. It is obligatory, and that obligatory compulsive change in the doses of the medicine is the bridge between your faith and your health. So the doses of the medications needs to be altered according to the fast you are observing. Now the second question remains, who needs what kind of change? As we have known till now that every diabetic, most of the diabetic requires some sort of change to prevent either very elevated blood sugar or very low blood sugar and other complications of diabetes. So usually diabetic patients, they are on multiple medications, and there are different type of medications which are being used for diabetes. Some patients are on metformin drug, or some patients are on gliptin drugs like sitagliptin, vildagliptin, teneligliptin, linagliptin, gliptin drugs. So these two group of drugs, either metformin or gliptin drugs, they usually do not cause low blood sugar. They do not cause low blood sugar usually, and they are quite safe. On the other hand, there are other groups of medications which are quite potent, like sulfonylurea drugs, like these are known as like glimepiride, available in the market, or glibenclamide or gliclazide. So these are known as sulfonylurea drugs, which are very strong anti-diabetic drugs, and they have the tendency to cause low blood sugar if it is not, dose is not adjusted properly. So they can lead on to low blood sugar, this glimepiride or glibenclamide or gliclazide drugs. So if you are on those drugs, it needs to be adjusted in consultation with the doctor. Third group of drugs, oral drugs that I'm talking, are known as gliflozin drugs like dapagliflozin or empagliflozin or canagliflozin. So this group of drugs, usually they also do not cause low blood sugar, but they have few unique complications which you need to keep in mind. And fourth group of drug are basically injectable drugs, which are insulin. And insulin have the highest tendency to cause low blood sugar if dose is not adjusted properly. So based on which drug you are taking, your doses needs to be adjusted accordingly. Suppose you are taking either metformin or gliptin group of drugs like teneligliptin, linagliptin or vildagliptin, they usually do not cause low blood sugar. So you need not adjust the dose. Suppose you are taking once a day dose, so you can take that once a day dose during your iftari. But if you are taking twice a day dose, then one you can take in the morning when you are having your early morning food, and second dose you can take during your iftari, and you need not change the dose. So that is quite easy, you need not change significantly. But what about the second group of drugs like glimepiride, like glibenclamide, like gliclazide? So these are known as sulfonylurea drugs, and they are very strong anti-diabetic drugs, and they have the tendency to cause low blood sugar if it is not adjusted properly. So you need to be a bit careful about these drugs. If you are taking these drugs, you are a diabetic and you are planning to fast. So how to adjust this group of drugs? So if you are taking this group of drugs like glimepiride or gliclazide, if you are taking once a day, then you can continue that once a day during your iftari. Just after iftari, you should take it as usual at the usual dose. But if you are taking twice a day, sometimes few of the patients, they take twice a day glimepiride, in the morning, in the evening. So if somebody is taking twice a day, then the evening dose, they can remain the same. Suppose one person is taking 1 mg in the morning and 1 mg in the evening. So 1 mg in the evening, he can maintain 1 mg in the evening with iftari. But if he is taking the morning dose also, the morning dose should be reduced by 30 to 50%. So if he is taking 1 mg in the morning, then he should take 0.5 mg in the morning while he is fasting. So cut down the morning dose by around 30 to 50% if it is twice a day dose. But if it is once a day dose, then you can maintain the same dose during iftari, you can take it. So that's how you should alter the dose of this group of drugs. But in this group of drugs, there is old generation drugs like glibenclamide, which was there previously, like the brand name was Dionel, which some of our patients still take it. So this group of drug, like Dionel group of drugs or glibenclamide group of drugs, they are very long acting. So rather than going for this group of drug like glibenclamide, you can go with glimepiride or gliclazide. You can switch over from glibenclamide to either glimepiride or gliclazide. That's how you can change your dose regarding the sulfonylurea drugs. Next group of drugs are the gliflozins like dapagliflozin, empagliflozin or canagliflozin. So they are also very good anti-diabetic drug, and they are not only anti-diabetic drug, they are good for our heart. So sometimes if the patient is not even diabetic, we prescribe them to patients who are having a heart problem, those who are having weakness of their heart muscle, or those who had a heart attack. We prescribe them. They may not be diabetic because this group of drugs are very cardiac friendly. They protect the heart. They're not only has a good anti-diabetic function, but they protect the heart as well. So if you are on this group of drug, then since this group of drugs do not decrease your blood sugar significantly, so you need not adjust the dose. The dose remains the same, but you need to be careful that this group of drugs can cause dehydration a bit. So you have to maintain your hydration. You have to maintain your water intake when you are in the non-fasting stage. So have adequate water intake, and if you have some GI issues like dehydration, like diarrhea or vomiting, you're not feeling well, then you should stop taking this drug. Temporarily you should withhold this drug. So this group of drugs, they do not cause low blood sugar on their own, but they can cause dehydration. So you need to increase the intake of water during non-fasting stage. So these are about the gliflozin group of drugs. Last but not the least are the drugs which are injectable like insulin. And this group of drugs like insulin are the most potent drug, most effective drug for diabetes, and they have the tendency to cause hypoglycemia if the dose is not adjusted properly. And there are various insulin regimens which are being used for the diabetic patients. Some insulins are used only once a day. They are long-acting insulin, and usually they are given at the time of dinner, once a day dose. So they are long-acting insulin like insulin glargine or insulin detimir or NPH. So these are long-acting insulin. Some insulin are mixed insulin, pre-mixed insulin like Mixtard 3070 or Novomix. These are pre-mixed insulin. They are given usually twice a day, in the morning and the evening. Sometimes there are multiple insulin injection which are given. One is long-acting insulin which is given at bedtime, and others are short-acting insulin given 3 times a day, before breakfast, before lunch and before dinner. So depending on what insulin regimen you are on, you need to change the timing and as well as the doses of the insulin. Suppose you are on only once a day insulin, that is long-acting insulin, which you are taking at bedtime. So if you are observing the fast, then you need to reduce this dose of long-acting insulin by 15 to 30%. Suppose you are taking 20 units of long-acting insulin at bedtime. So reduce by around 6 units. You can take around 15 units during your iftari. So reduce by 15 to 30% and take it along with your iftari during evening. So that's how we can adjust so that it prevents hypoglycemia. What about if you are taking a premixed insulin like a Mixtard 3070 or Novomix 3070? This premixed insulin usually are taken twice a day, once in the morning, once in the evening. And usually it is given doses is like 2/3 and 1/3. Suppose somebody is taking 30 units of insulin, premixed insulin, Mixtard 3070, 30 units of insulin. So out of these 30 units, usually 18 units are given in the morning and 12 units are given in the evening, because it is 70-30 ratio, in that ratio almost. So majority of the dose are given usually in the morning and a small amount is given in the evening. But if you are observing fast, if you are a diabetic and you are taking this premixed insulin, then what you need to do is that you need to swap the doses. That means the evening dose should come in the morning and morning dose should come in the evening. So suppose you are taking 18 units during morning and 12 units during evening in normally when you are not fasting. So when you are fasting, that evening morning 18 dose should come in the evening. So that 18 you can take in the evening or almost the same dose, and the evening 12 units should come in the morning before the suhoor or sahri. And these 12 units you can reduce by around 30 to 50%. So rather than 12 units, you take around 6 units. So that's how you can change the dose of the premixed insulin. You can swap morning dose, you should take it in the evening, and evening dose you should take in the morning. Evening dose you can keep the same almost, while the morning dose you can decrease by 30 to 50%. And if you do that, chances of blood sugar fluctuation comes down significantly. Now next question comes, what if you are taking multiple insulin injections, where one insulin is the long-acting insulin which you are taking at bedtime once a day, other insulin are 3 insulins, short-acting insulin, one before breakfast, one before lunch, one before dinner. So what about those? So the basal insulin which you are taking at bedtime, you should reduce dose by 20 to 30%. So if you are taking 20 units of a basal insulin like glargine insulin, so rather than taking 20 units, you can take 15 units along with iftar. And what about the 3 bolus insulin, short-acting insulin? So since afternoon there won't be any lunch, so afternoon dose you can omit. There is no afternoon dose. What about the morning dose? So morning dose you can reduce a bit. You can reduce by 30 to 50% the morning dose, while the evening dose before the iftari you can maintain the same almost. So that's how multiple doses of insulin could be managed, both the basal insulin as well as the bolus insulin. Afternoon dose needs to be omitted. So if you follow this, the chances of blood sugar complication minimizes. What about those patients who are type 1 diabetics, who are taking multiple insulin, those who are having complications like diabetic eye complication or kidney complication or heart complications? Those usually are advised not to undergo fasting. But if they want to undergo fasting, then ideally they should have a continuous glucose monitor and they should monitor their sugar very frequently. Otherwise, it's better for them not to fast. So these are basically a generalized approach which may not be applicable to all. So this is a generalized approach. For your personal thing, you need to fine-tune with your doctor. Your personal requirement and personal doses needs to be fine-tuned. But these are the generalized approach as we have been discussing. And there are some misconception and somewhere people go wrong. So what are those things where people go wrong? One is people think that I'll take the medicines or insulin as usual, I won't change it. So that is something which is wrong approach, because during Ramadan or during Ekadashi in Hindu rituals, if you are observing fast and if you are not adjusting the doses, then the chances of blood sugar high or blood sugar low increases significantly. Especially some people, they skip the suhoor completely. So if they skip the suhoor completely or take less food during that time, and if they continue taking the same doses of medication, either tablets or insulin, by mid-afternoon their blood sugar comes down dangerously low. At the same time, some people overeat during iftari. So if they overeat, what happens? The blood sugar increases significantly after food intake. So to circumvent that, we need to give more insulin or more tablet. So that causes a fall during the late night or early morning. So that causes a blood sugar typical rise and significant fall. So that leads on to complication. So the principle is that be in moderation. Do not skip your food. Neither you should not overeat. So take your food on time and it should be done in moderation. Another common notion is that people think by checking their blood sugar, they are breaking their fast. While no religion actually says by checking the sugar, you are breaking your fast. And even medical science also says that you should always check your blood sugar if you are fasting, if you are diabetic, because otherwise the risk of complication increases significantly. So you should plan your fasting during Ramzan month or during Ekadashi if you are a Hindu, so that you can have an uncomplicated fasting schedule. So before the fast itself, you should visit a doctor, should have a proper planning of the meal as what to take, what not to take, that we have already discussed in prior videos. What should be the composition of the diet, how much to take and when to take, how to adjust your doses of medication, be it oral medication, be it insulin, and how to check your blood sugar, how often to check your blood sugar, and when to check your blood sugar. So and have a proper planning and education and knowledge about diabetes management. So if you follow those, then you can have a very safe and uncomplicated fasting schedule. As my patient who had experienced recently, he had been my patient for over last 1 decade or so, and he had been observing fast every year during Ramzan. But every year during Ramzan, because of unplanned fasting schedule, he is a strong diabetic who is on insulin and oral medications. He used to land up in emergency with very low blood sugar, and he used to trouble his family. So this time, last year, when he came to me, he was telling that I do not want to trouble my family. So I want a proper planning so that my blood sugar remains stable all throughout my fast. And I want to fast also. So we had adjusted his medication. Since he was on sulfonylurea drug, which is a very potent sulfonylurea, he was taking once a day in the morning. So we had shifted from morning to evening dose. So his glimepiride, he was taking 1 mg. It was shifted from morning to evening with iftar. And he was on insulin also. He was having a premixed insulin, mixture 30-70. So 1 in the morning, 1 in the evening. So we had swapped the dose. The evening dose goes in the morning, and morning dose went into evening. And morning dose was reduced by 30 to 50%. As well as we had asked him to check his blood sugar at a frequent interval and write it down and send the log report to us on a frequent interval. With this change in his approach, he was able to observe his fast without any visit to the emergency room. And not only that, his even HbA1c also had improved. So it was not a magic, it was basically a proper planning and proper education. So that's why if you are observing fast, it is important that you plan your fast beforehand. You visit your doctor. First of all, you should know whether you should be able to fast or not. Take a consent from your doctor. Have a proper meal planning. What all meals we should take it. What all foods you need to take it. What all foods you need to avoid it. How to check your blood sugar. How often to check your blood sugar. If you are on a medication, how to adjust the dose of the medication. Be it oral medication or be it insulin. So with all those guidance and planning, you would be able to do a safe fasting. So if this video has helped you in understanding as how to observe fast safely, kindly share with somebody who is a diabetic, who is on medication, but who wants to observe fast due to religious reason. It could be a Muslim who wants to observe fast during Ramzan, or it could be Hindu also who wants to observe fast during Ekadashi. And kindly like, share and subscribe to our channel. In the next video, we would like to discuss about how often, how frequently and what time you should check your blood sugar so that you have an uncomplicated fasting.